Hi Faris, can you briefly introduce yourself and your sport?
Okay, so hi, my name is Faris and I am a rugby player and I specialize in endurance training.
Okay, I have some question. Have you ever experienced breathing problem during intense exercise?
Yep, I experience exercise-induced asthma, especially during high-intensity training.
Ah, what usually happen when your asthma is triggered?
I usually feel tightness in my chest, difficult to breathe, and also sometimes wheezing.
Do you also experience respiratory muscle fatigue?
Yep, after a long training session, my breathing muscle feels tired and it makes me become harder to breathe deeply.
Mm, have you ever trained at high altitude?
Yep, I've done altitude trainings, and at first, it was difficult for me to breathe due to low
Mm.
oxygen levels.
So how did your body adapt to altitude training?
Um, After some time, my breathing became more efficient, my stamina improved a lot, and obviously, especially after I returned to sea level.
Ah, okay, I see. How do all these respiratory challenge affect your performance?
They affect my endurance, but with proper training and breathing control, I can overcome them and can still perform well.
Okay, last question. What advice would you give to athlete that facing similar problem like you?
Um, I would say manage your body condition properly, practice correct breathing techniques, and also always listen to your body so that you can manage when to push and when to rest so that you will get to your maximum level of your um, body. Yes.
Okay. Thank you, Faris. That's all.
Okay. Bye bye.
Okay.
Hi, my name is SYARIFAH AMIRAH, and I will be presenting about the case background. This case background shows a 19-year-old endurance athlete which specializes in football and also rugby. He has been following a strict and intense training program aimed at improving his endurance performance. However, for the past few weeks, he has been experiencing breathing difficulties during exercise. The athlete presents with exercise-induced asthma and also noticeable muscle fatigue. During training sessions, he reports symptoms such as wheezing, shortness of breath, and chest tightness, particularly after intense activity. These symptoms worsen as exercise continued, making it difficult for him to do his daily training routine. In addition to asthma-related symptoms, the athlete also experienced muscle fatigue during intense workout. He describes his breathing muscles feels heavy and is struggling to take deep breaths during a high-intensity workout. Environmental factors also play a role in this case. When training at high altitudes, oxygen levels are lower and thus making his breathing more difficult. These conditions also contribute to asthma symptoms and also trigger to increase in respiratory strain. Overall, this case highlights how intense high endurance training combined with environmental stresses can negatively impact the respiratory function and also athletic performance with exercise that induce asthma.
Assalamualaikum and hello everyone. My name is ALIEF Darwis bin AIZRUL AZIZI. My student ID is 20244460004. Today, I will be presenting about how the respiratory system adapt during exercise, especially in athletes who experience certain breathing challenge. Okay, during exercise, our body need more oxygen to produce energy. Because of this, our breathing rate and the amount of air we take in both increase. This helps the muscle work better and for a longer time. For athletes, these respiratory adaptations are very important. Their lung and breathing muscle must work efficiently to support high intensity training and performance. However, some athletes face challenge like exercise-induced asthma where the airway become narrow, or respiratory muscle fatigue, where breathing muscle get tired. Athletes who train at high altitude also need to adjust to lower oxygen level. By understanding this condition and how the respiratory system responds, we can find the way to improve breathing efficiency, increase oxygen delivery, and help athletes perform better. Thank you.
Hi, my name is ZARIF, and today I will talk about the physiological adaptations. And yeah, there are three main parts, which is the cardiovascular adaptations, respiratory system adaptations, and also the muscular adaptations. So we go to the first one, which is the cardiovascular adaptations. And the regular exercise increase the stroke volume, which means the heart will pump more blood with each beat. This helps improve oxygen delivery to the muscles. And next exercise causes a lower resting and sub-maximal heart rate. This happens because the heart rate becomes stronger and more efficient, so it does not need to be as fast as during the light exercise. And lastly, there's an increase in capillary density. More capillaries will form around the muscles, and which improve oxygen exchange and helps muscles for better during exercises. And now to the second one, which is I will explain about respiratory system adaptations. And first one is during intense exercise, there can be an increase in airway sensitivity. Dry or cool air or heavy workouts may trigger bronchoconstrictions and making breathing even harder. And exercise can also cause respiratory muscle fatigue. This happens when airways become narrow and increasing the resistance. And the last one, as a result, a person may experience heavy breathing and limited performance, especially during the intense workout or activities. And now we go to the last point, which is the muscular adaptations. And exercise increases mitochondrial density in muscles. This allows muscles to produce energy more efficiently, and there is also an increase in aerobic enzyme activity, which helps improve endurance performance, so the athlete can stay longer in the field or in the games that they play. And finally, the exercise can improve the lactate threshold. By saying this allows a person to sustain high intensity exercise for a longer time before feeling tired or fatigued.
Hi, my name is Ailin Sofiya, and next we will explain the problems and limitations that athletes may face related to respiratory function during exercise. The first problem is airway constrictness, also known as exercise-induced asthma. During intense physical activity, some athletes experience narrowing of their airways. This happens especially in cold or dry environments. When the airways tighten, it becomes harder to breathe, which leads to wheezing and shortness of breath. This can reduce the athlete performance and make it difficult to sustain high-intensity exercise. The second limitation is respiratory muscle fatigue. During long or intense workouts, the muscles that help us breathe, like the diaphragm, must work harder. Over time, these muscles can become tired, and when this happens, breathing becomes less efficient, and the athlete may feel out of breath much faster than normal. This reduces endurance and affects overall performance. The third limitation is reduced oxygen availability at high altitude. At higher elevations, the air contains less oxygen. Because of this, the body has to work harder to take in the oxygen it needs. As a result, athletes may feel tired quickly, breathe faster, and struggle to maintain their usual performance level until their body adapts to the altitude. So, overall, this respiratory limitation can significantly affect athletic performance. Understanding that helps us develop strategies to improve breathing efficiency and support athletes during training.
Hi, my name is NURFARAH BATRISYIA BINTI ZULKEFLI, and I will talk about a strategy for optimization. The first one is breathing exercise and respiratory muscle training. Breathing exercise, such as a deep breathing or diaphragmatic breathing, help the diaphragm and intercostal muscle work more efficiently. By strengthening this muscle, the lungs can take in more air and remove carbon dioxide more effectively. Control breathing or breathing retraining is also very helpful for people with airway disorder like asthma. It can improve airflow, reduce airway tightness, and increase measures such as peak expiratory flow rate. For athletes, stronger respiratory muscle allow them to maintain deep or frequent breathing during exercise with less fatigue, which directly supports better endurance. The next one is gradual altitude adaptation. Training at high altitude or gradually adapting to the lower oxygen level can also improve respiratory function. Over time, the body increases red blood cell production and improves oxygen delivery throughout the cardiovascular system. For athletes, this adaptation makes both the respiratory and circulatory system more efficient at supplying oxygen during periods of high demand, especially during intense exercise. The third one is proper hydration. Hydration plays an important role in maintaining healthy airway. When the body is well hydrated, the airway lining and mucus stay moist, allowing air to flow more easily. In contrast, dehydration can irritate the airway and reduce airflow efficiently. For athletes, staying consistently hydrated helps prevent exercise-induced respiratory issues and support better lung function during training. The fourth one is warm-up routine. A proper warm-up gradually increases ventilation rate and breathe deep, preparing the lung for more intense physical activity. This ensures that oxygen intake and carbon dioxide removal are optimized right from the start. As exercise intensity increases, warm-up also improve oxygen delivery to tissues by increasing blood flow around the lung and engaging additional respiratory muscle. This reduces the risk of airway concentration and respiratory stress. Finally, the last one is asthma management, which is inhaler and controlled breathing. In asthma, the airway often tightens or swells, which restricts airflow. Inhaler help relax and open the airway quickly. When combined with slow, controlled breathing techniques, especially diaphragmatic breathing, airflow can maintain more effectively. Research shows that long-term breathing retaining can improve lung capacity and reduce the frequency of asthma flare-ups, supporting better overall respiratory health.
Okay, so for conclusion, this case highlights the crucial role of respiratory systems in supporting athletic performances by supplying sufficient oxygen and removing carbon dioxide during exercise. Athletes undergo important respiratory adaptations such as increased breathing rate, stronger respiratory muscles, and also improve gas exchange to meet the rising oxygen demands during physical activity. But however, conditions like exercise-induced asthma, respiratory muscle fatigue, and the effect of altitude training can challenge breathing efficiency and limit the performance of the athlete if it is not managed properly. Therefore, understanding these adaptations and challenges is essential to help the athletes to maximize endurance, maintain optimal performance, and also to protect them for a long-term respiratory health.